Assalamu alaikum. Myself Mohammad Talal. I am the student of Osh International Medical University, first year student group 1B. Today our topic is bone. Our skeleton is made up of bone. What are bones? All bones are developed from mesoderm. And bones is made up of collagen type 1 and calcium phosphate. There we have function of bone. But then we discuss function of bone. Bone gives shape and support to the body. Our bone gives shape and structure to our body and provide attachment to tendon, muscle and ligament. They also provide tendon and ligament to our body. Then we discuss about classification of bone. What are the classification of bone? Bones are classified on the basis. These basis bones are classified. Bones are classified on the basis of their morphology. Both are divided into 5 categories. Our classification of bones are divided into 5 categories. Then we discuss about types of bone. There we have 6 types of bone: long bone, short bone, irregular bone, flat bone, sesamoid bone and pneumatic bone. First of all, we discuss about long bone. As you know, long bone have more length more than its width. For example, humerus. Then we discuss about short bone. So bone has small length than width. In short bone, small length than width. Length has small than its width. Then we discuss about irregular bone. Irregular bone have different shape and size. In irregular bone, there is no same size and shape. Its length are different, its width and different. They are totally different with each another. Then we discuss about flat bone. Flat bone have flat surface. It has flat surface. For example, frontal bone and our frontal bone is example of flat bone. Then my second loss, sesamoid bone. Bone present in tendon. For example, patella. Our bones, our sesamoid bone are present in tendons. Then our last types of bone is pneumatic bone. Pneumatic bone have air-filled space. In pneumatic bone, there are air-filled space. They have space to out and go air. For example, maxilla. There we draw a diagram of bone. As you see that our bones are that type. There we have this type diaphysis and the till last and metaphysis. As you saw that this is the compact bone. In front there is red bone marrow, metaphysis, etc. Allah Hafiz.
Assalamu alaikum, me Rizwan Akram, student Osh International Medical University from first year group 1B. Today we discuss about general anatomy. What is anatomy? Anatomy is the branch of medical science which deals with the study of and structure of our human body. Now we discuss about skeleton. What is skeleton? Skeleton, 2 types of skeletons in our human body present. Firstly, axial skeleton and second, appendicular skeleton. As well now, axial skeleton consists of 80 bones in our human body, and second, appendicular skeleton is consists and present 126 bones in our human body. Now we discuss about axial skeleton. Firstly, axial skeleton consists of many bones, but we discuss about all of these 80 bones. Firstly, axial skeleton, the role of axial skeleton in our human body. Axial skeleton contain vital organs like heart, sternum, lungs, and inside our abdominal part. Firstly, cranial skulls. There are 8 bones in cranial skulls, and there are 14 bones in our facial skull. Then 6 bones are present in air, and other 26 vertebrae present in our back side of human body, and the ribs, 24 ribs, like these ribs connected with sternums. Firstly, we discuss about the ribs, how ribs are total in numbers. 12 pair of ribs are present in our human body. Firstly, first 7 are true ribs because of connected with sternum directly, and other 3 ribs like 8, 9, 10 are false ribs because not connected directly with sternum, and other 2, 11 and 12 ribs are floating ribs. Just protect the organs like kidney, lungs and other things. Now we discuss about appendicular skeleton. What is appendicular skeleton? Appendicular skeleton mainly present on upper limb and lower limb. Firstly, a particular skeleton based on upper limb and lower limb. We discuss about the parts of upper limb, the features and the structures of upper limb. Firstly, shoulder. We discuss about the shoulder present in upper limb. Shoulder. What is shoulder? The four bones are present in shoulders. Like firstly, clavicle. Other bone is scapula. On other side, the scapula and clavicle are also present in shoulder. Now discuss about forearm. What is forearm? Forearm like present in three bones like humerus, radius and ulna. Firstly, humerus start from clavicle and on knee joint and on elbow, and radius and ulna start from elbow and end on wrist joint. Now we discuss about forearm, like we discuss humerus, two pairs of humerus bones present in our human skull, two humerus, two radius. On one side is one bone present and other side is second bone present. So we discuss so we call pairs. Then other bone is ulna. Then we discuss about wrist. Then carpal bones. What is carpal bones? Carpal bones present near the wrist. Total 8 carpal bones present in our human body. In the forearm, and the other metacarpals are 5. We would multiply the bones of these wrist bones. Then if carpals are 8 bones in one hand, then if we multiply by 2, then 16 are in number total carpal bones, and other metacarpals and phalanges. 14 bones are in forearm, and we discuss about now lower limb, which is based on a appendicular skeleton. First, we discuss about pelvic girdle. Pelvic girdle. What is pelvic girdle? It is based and present on hip joint. Like now, we discuss about thigh with femur. Thigh, like the bone and the femur, the longest and strongest part of our human body. Now, knee joint based on patella, which is sesamoid bone. And now further we discuss about tibia and fibula. Okay? Then we discuss about ankle of human skull, tarsals, metatarsal, phalanges. Okay, if we multiply the tarsal, because as we know the bones are 2 in numbers. Like tarsal, if we multiply the tarsal bone, 7 multiplied 2 is equal to 14 bones in our human skull. Now, so if 14 tarsal in human skull, now discuss about metatarsal. 5 multiplied 2 is equal to 10 bones in our 2 legs, and phalanges 14 is equal to 28 phalanges in our human skull. Now we discuss about types of bones. Like which type of bones present in our human body. Firstly, our flat bone. Now other short bone. Third, long bone. Fourth, irregular bone. Fifth, sesamoid bone, and sixth, pneumatic bone. Flat bone. What is flat bone? Flat bone is embedded spongy-like bone, and short bones are no more width in long, and the long. If we discuss about the long bone are more lengthened as compared to width in short bones. Now, fourth part is irregular bones, like our ribs. Irregular bone are different in shape, and sesamoid bone. The sesamoid bone present in knee joint. The main example of sesamoid bone is patella. Now the rheumatic bone is the 6th bone, as we now thank you.
Assalamu alaikum. Myself Uzma Sher, student of Osh International Medical University, first year from Group 1B. Today we discuss about in detail joints. So first of all, we discuss joints and their types. Joints, the junction of 2 or more bones on cartilage, they articulate to make a joint. They may move or not. There are 3 types of joint, FSC. F stands for fibrous joint, S for synovial joint, and C for cartilaginous joint. Fibrous joint, presence of fibrous tissue and less movement of joint. For example, sutures in human skull. Cartilaginous joint, 2 types of cartilaginous joint and presence of cartilage in our joint. Primary cartilaginous joint and secondary cartilaginous joint. Primary cartilaginous joint, there is no movement in primary cartilaginous joints, and immovable joint. For example, manubrial sternum joint. Secondary cartilaginous joint, there are less movement in secondary cartilaginous joint. For example, pubis symphysis, there is less movement in this joint. So then synovial joint. Synovial joint, presence of synovial cavity, synovial fluid and synovial membrane. There are following types of synovial joint. First of all, we will discuss about condylar joints. Condylar joints present in our knuckles, and ellipsoidal joint in our wrist, and thumb joint is the example of saddle joint. Thumb joint is the first metacarpal joint. Elbow joint is the example of hind joint. Ball and socket joint is the example of hip and shoulder joint. Then the last type of synovial joint is plane joint, is the example of sternoclavicle joint. Then we discuss about classification of joints. There are three types of classification of joints. Amphiosmosis joint is the example of amphiosmosis joint in which less movement, and its example is tibiofibular joint. Synarthrosis joint in which no movement is the example of which protect our organs, heart and lungs. Then the last type is diarthrosis joint, in which full movement, for example ball and socket joint. Ball and socket joint also the example of shoulder and hip joint. And then we discuss about most common dislocated joint. Most common dislocated joint is hip joint, which are common in children at the age of 5 years. We can see the difference between three types of joints. Fibrous joint in which is immovable joint, sutures present in human skull. You can see in this diagram.
Myself, Dr. Mudassir Ali, student of OSH International Medical University from first year. Today, my topic of presentation is joints and its types. First of all, definition of joint. Joint is the junction where two or more bones connect and form movable or slightly movable joints. There are some types of joints, types FSC. We nominate this nomination by first is fibrous joint, then cartilaginous joint, then synovial joint. Fibrous joints in which fibrous tissue is present, they possess less movements, and the example of fibrous joint is the sutures of skull. Then we have another type of joints, that is cartilaginous joints. Cartilaginous joints are of two types, primary cartilaginous joints and secondary cartilaginous joints. First of all, we will discuss about primary cartilaginous joints. Primary cartilaginous joints are immobile, and the example of this joint is malleolosternum joint and SCJ. Then we will discuss about secondary cartilaginous joints. These joints possess less movements, and the example is sternoclavicular joint, vertebrae, and pubis symphysis joints. Then we will discuss about third type of joints, synovial joint. In synovial joint, synovial cavity, synovial fluid, synovial membrane, and synovial capsule is present. There are some types of synovial joints, which are condylar, ellipsoidal, saddle, hinge, and ball and socket, and plane joints. Some examples of these joints are truncal joint is example of condylar joint. Wrist joint is example of ellipsoidal joint. Thumb is example of saddle joint. Elbow is example of hinge joint. And hip or shoulder joint. This shoulder joint is example of ball and socket, and of plane joint is example of sternoclavicular joint. Then the joints are classified into three types. First is synarthrosis joint, second is amphiarthrosis, and third is diarthrosis joint. Synarthrosis joint. These joints possess no movements or less movements. They protect internal organs, and the example of synarthrosis joint is malleolosternum joint. Then second classification of joints is amphiarthrosis joint. These possess less movements, and these are tibiofibular and pubic symphysis joints are example of amphiarthrosis joints. Then we have third classification of joint. It is diarthrosis joint. They possess full movements, and its example is ball and socket joint, like shoulder joint or hip joint. Thank you.
I am a student of Osh International Medical University from first year group 1B. Today our topic is liver. Liver. First of all, liver is Latin word. Hepato and hipper. Then its location. Location upper right side portion of the abdominal cavity. Shape. Shape इसकी है wedge shaped gland. Color इसका हो जाता है reddish brown. Then its types. Liver. Liver is 4 lobes. Larger right and left lobe, and then smaller is quadrate and caudate lobe. Then discuss the liver. The liver is the dual blood supply. 75% of the blood is deoxygenated, goes through the portal vein, and 25% of the blood oxygenated goes through the hepatic artery. Then we discuss liver. Liver having 8 segments. Liver having 8 segments. Then right 2 lobes in right lobe and left lobe. Left lobe is 2 segments. 1-4 is lateral segment. 2-3 is medial segment. And 8-5 is anterior segment. 7-6 is posterior segment. Then we discuss the hepatic lobules. Hepatic lobules is a hexagonal shape and structural unit of the liver. 3 zones. First zone is portal zone. Portal zone जो है Tourette zone. Then second zone is intermediate zone. And third zone is the pericentral zone. Pericentral zone to poor zone, and it's affected by alcohol, ischemia, and injury.
Rahim, myself Mohammed Zain. I am from first year Osh International Medical University. Today we discuss about bone of upper limb. Bone of upper limb. Now we can start. Bone of upper limb. First bone of upper limb start from clavicle. Clavicle is the first bone of the upper limb. Okay, you can see clavicle. Clavicle is the first bone that is ossified intramembrane. Okay, it is the also first bone, longest first bone that lies horizontally. Anyway, otherwise all the longest bone are in our body lies vertically. Okay, it doesn't have medullary cavity. After the clavicle, we have scapula. Scapula is present is backward of the, you can see domain backward of the clavicle. Okay, it is a triangular shape. Its shape is triangular. Okay, it is also called shoulder blade. Its shape is triangular and it has 3 borders and angles. Scapula have 3 angles and borders. Okay, after scapula we have humerus bone. Humerus bone is the longest and thickest bone of the upper limb. Okay, longest you can see from here, longest and strongest bone of upper limb. Its ossification starts from 8th month. Okay, its ossification starts from 8th month and it's ossified till 18 years of age. Okay, it has 2 necks. Humerus has 2 necks. Now you can see from here, humerus has 2 necks. Anatomical neck and surgical neck. The neck which is mostly fractured or break is the surgical neck of the humerus. Okay, after humerus, humerus has some other parts. For example, it has condyle. Okay, medial epicondyle and lateral epicondyle. Between 2 condyles, there are bicipital groove. Okay, after humerus, there we have radius bone. Radius bone is the bone of the forearm. Starts after the humerus. It is the lateral bone of forearm that is present lateral side of the forearm. Its head covered by hyaline cartilage. It makes joint with wrist joint. From the wrist joint, it is most widest and thickest as compared to the ulna. Okay, after another bone is of forearm is ulna. It is the medial bone of forearm. Medial bone that is present inside of the forearm. You can see from here, it is the medial bone of the ulna. Okay. It has 2 processes and logic that are present on head of the ulna and that are attached with the humerus. Okay, it has 2 processes, and after ulna we have carpal bone. Carpal bones are the bones of wrist. There are total 8 carpal bones that are present in wrist of our hand. Okay, you can see from here scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and humate. After carpal bones, we have 5 metacarpals that are present after carpal bone. After metacarpal, we have total 14 phalanges that are present in our hand now. There are complete bone.
Assalamu alaikum. My name is Rania Mustafa Ali from Osh Medical University, Pharmacy from Group 1B. Today we want to discuss about bone of upper limb. Let's see. Humerus bone, longest and strongest bone of upper limb. Neck, anatomical neck, surgical neck, most chance of fracture, surgical neck. Tubercle of humerus, greater and lesser tubercles. Present at proximal end of bone. Groove, depression below lesser tubercle and greater tubercles. Ependycondian, the bone bumps present at lower end of humerus. Radius and ulna. Ulna is attacked with interior part of humerus. Radius is not directly attacked with humerus. Next to see about skeleton, neck, head, and greater and lesser tubercle. Surgical neck, humerus, okay, ulna and radius. Thanks to see.
Assalamualaikum. My name is Muhammad Yasir Hassan. I am a student of Osh International Medical University. Today my topic is joints. Introduction. Articular of two bony make a joint. It is also called ortho. Inflammation of joint is called arthrist. Types of joint. On the basis of structure. Fibrous joint, cartilaginous joint, synovial joint. Now we will explain fibrous joint. Fibrous joint. Suture line, suture, dense fibrous connective tissue, ulna, radius, socket, gomphysis, root of tooth, peritoneal ligament. Cartilaginous joint. Cartilaginous is a hyaline, connective tissue is a hyaline cartilage. Example between manogram and first is epiphyseal growth plate become synostosis. Metaphysis, epiphysis, diaphysis. Types of synovial joint. Hip joint. Wrist joint. Synovial joint. Run, jump, grab, gesture. Synarthrosis no movement. Amphiorthrosis slight movement. Diarthrosis freely movable. It is not movable. Suture in human skull. It is made from fibrous connective tissue. Cartilaginous joint. It is made from cartilage tissue. It is slightly movable is present. Example, elbow joint. And knee joint. Mandible. Synovial joint. It is freely movable joint. In synovial joint, synovial cavity are present. Between synovial joint or synovial are present. Synovial cavity are present. In synovial cavity, a synovial joint, a synovial fluid is present. Types of synovial joint: hinge joint, saddle joint, ball and socket joint. Hinge joint. In this type of joint, only one side movement is present. Movement at 45-degree angle. For example, knee. Saddle joint. In this type of joint, 3-axis movement. Wrist, thumb, ball and socket joint. Most important joint. In this type of joint, 360-degree angle movement is present. Only one surface is bone-like structure and other is cup-shaped structure. Example, pelvic bone. Classification of joint: amorphous muscle joint, tibiofibular joint, pubic symphysis joint. Structurally weak joint. Shoulder girdle. Frozen shoulder in which two synovial membranes stuck together which causes stiffness and immobility. Most common dislocated joint, hip joint. There are more chance to dislocate hip joint under the age of 5 years. More than 40-year age you may get osteoarthritis.
Assalamu alaikum. My name is Muhammad Abbas Hussain. I am student of Osh International Medical University, first year. Today my topic is about basic anatomy. Anatomy is often defined as the study of structure of an organism and relationship of its parts. Anatomy is the branch of medical science which deal with the study of structure of different organ and body parts of human. Then we talk about clinical anatomy. The practical application of anatomical knowledge to diagnosis and treatment is called clinical anatomy. There are two types of anatomy: gross anatomy and gross anatomy or macroscopic anatomy, or second one is microscopic anatomy. Macroscopic anatomy, it involves the study of structure which can be seen with naked eye. Microscopic anatomy, it involves the study of structure that can be seen under microscope. Comparative anatomy, it is the study of similarities and differences in anatomy of different species. It is closely related to evolutionary biology. And then we talk about plane and axis. Planes, it is an imaginary flat surface running through the body. Axis, it is an imaginary line at the right angle to the plane about which body rotates or spins. Types of plane, there are three types of plane: sagittal plane, transverse plane, and frontal plane. Then we talk about types of axis. There are three types of axis: vertical axis, sagittal axis, and frontal axis. Then we talk about planes. Median plane or mid-sagittal plane, parasagittal plane, frontal or coronal plane, transverse or horizontal plane, oblique plane. Median plane, mid-sagittal plane, a plane that divides the body down the middle into equal left and right side is the median sagittal plane. This vertical top of the bottom plane divides the body into left and right side. Parasagittal plane, it is the plane running or cutting the body parallel to the median plane. Example of parasagittal plane are mid-clavicular plane.
My name is Nazar Jaid from Group 1B. Today my topic is branches of anatomy. Now discuss about neuroanatomy. Study about nervous system, functional anatomy, study about relationship between functions and structures. Human anatomy, study about the structures of human beings. Now discuss about phytoanatomy, study of internal structures of plant, and zooanatomy, study about the dissection of animals. Embryology, study about the fertilization gametes and the formation of zygote.
My name is Khatija Parvez. I am the student of first year Group 1B. Today our topic is Introduction of Human Anatomy. First of all, we have to discuss about anatomy definition. It is the branch of medical science which deals with the structure of human body. Now, clinical anatomy, the practical application of anatomical knowledge to diagnose. We have two types of anatomy. First of all, we have to discuss about microscopic anatomy, then macroscopic anatomy. Microscopic anatomy, it is a type of anatomy which cannot be seen by naked eye. For example, tissues, cells, molecules, etc. Then microscopic.
Assalamu alaikum. My name is Ariba Noreen. I am first year student from Group 1B. Today my topic joints and its type. Now we discuss about joints. A joint is the point where two or more bone make contact. Type of joints. There are three types of joints: fibrous joints, synovial joint, cartilaginous joint. Next, fibrous joint. The bones are joined by strong fibrous tissue rich in collagen and they are less movement. For example, suture in human skull. Next, cartilaginous joint. It shows more movement as compared to fibrous joint is called cartilaginous joint. Type of cartilaginous joint. There are two types of cartilaginous joint: primary cartilaginous joint, secondary cartilaginous joint. Primary cartilaginous joint, there are no movable joint, mammalian sternum. Secondary cartilaginous joint, they are less movable joint. For example, vertebra and pubic symphysis. Synovial joint, which contains synovial cavity, synovial fluid, synovial membrane and capsule.